Hi everyone, I'm Dr. Heidi. I'm a dermatologist and pediatric dermatologist and mom of 3 little kids. I am here to talk about sun protection and sunscreen. May is Skin Cancer Awareness Month, and May 2nd was Melanoma Monday, so we can't let this month pass by without talking about sunscreen, sun protection, and skin cancer. So let's get started. So in the past, we thought sun exposure was a health benefit of being outdoors, but now we know that excessive sun exposure can cause skin damage, wrinkles, and even skin cancer. So we need to protect our skin against too much sun. So part of the sun's energy that reaches the earth, but we can't see it with our eyes, is the ultraviolet light, the UV rays. There are UVA, UVB, and UVC rays. UVA and UVB both can penetrate the skin. UVB is usually the sun rays that cause sunburn. So if they damage the skin, you'll see it. You get a sunburn, and then that redness and burn turns into tanning, and you can actually see that. Freckles are almost always a sign of too much sun and indicates to us that the person needs to be using more sun protection and more sunscreen. So that's kind of a good hint. Sunburn is another form of visible sun damage. So you get the red, the blistering, the inflammation in the skin a few hours after being in the sun, and then eventually that would fade away, and a lot of people causes more tanning and more pigmentation after the sunburn has resolved. And then there are invisible sun damage. So a lot of sun damage can actually be repaired by our own body. We have amazing capability of repairing the damage that has been done to our cells. But when you have cumulative sun exposure and sun damage over 20 and 30 years, that's when it happens to add up and lead to skin cancer. So a lot of people ask me, oh, I have had like sun exposure in the past, or I've had sunburns when I was little, or when I was young, or my child had a sunburn. What do I do now? It doesn't matter. We got to start now. We got to start sun protection, sunscreen now to prevent the accumulation of sun damage, which eventually would lead to irreversible sun damage and skin cancer. On the flip side, I hate to be the bearer of bad and scary news, but I have to mention this, that one blistering sunburn before age 18 doubles the risk of melanoma in adulthood. Melanoma, the deadliest form of skin cancer. Let's go over that one more time. One blistering sunburn before age 18 doubles the lifetime risk of melanoma, the deadliest type of skin cancer. So it is so important as a parent to just pay attention to the amount of sun and sunburn and sun damage that the kids are getting. So do your best. So what can we do to protect ourselves from the sun? Well, everybody thinks about sunscreen the first thing, but I am here to tell you avoidance is the #1 protective factor. What does that mean? Do I want you to not go outside and enjoy your life? Absolutely not. I live in California. It's always sunny. There's so many good things about getting outdoors. What it means is that try to avoid direct sunlight on your skin. So when you're outside, especially between the hours of 10 to say 3-4 p.m. when the sun rays are very strong, you need to start seeking shade, going under a tree, an umbrella, a tent, anything that would prevent direct sunlight onto your exposed skin. A good rule of thumb is that if your shadow is shorter than you, then the sun is directly above you and it's too much sun, so you need to seek shade. Also remember that the closer we get to equator, the higher we get on the mountains or elevations, when we have water around that could reflect the sunlight, when we're on the snow or white sand that could reflect the sun, that kind of increases the amount of sun we get. So then we have to be more careful. As much as possible, it's great to schedule outdoors activities in the morning or after 3 or 4 p.m. if your lifestyle allows for it. For example, we always try to go to the beach after 3 or 4 p.m. It actually serves 2 purposes. One is that the sun is not as strong. Also, most people by then are heading home, so we get a more quieter beach. So think about it in that terms. Can you reschedule your outdoors activities in a way that you get to do them early in the morning before the sun gets too strong, or later in the day when the sun is kind of mellowing down a little bit? So those are the kind of avoidances that you want to incorporate into your daily lifestyle. And again, seeking shade is so important. Always when you're going to the kids' sports events or you're having a day at the beach, carry with yourself a tent or an umbrella that can provide shade over everyone. There's only so much sunscreen can do. And I hear this from people all the time that I use sunscreen, but I still got burned. You will, because the sunscreen isn't 100% protective. Also, most people don't use enough sunscreen. There are studies that have shown most people use a quarter, only 1/4 of the recommended amount of sunscreen. So one is that we don't use enough of it, and two is that it's not 100% protection. So seeking shade is very important. The other factor would be sun protective clothing. A wide brim hat is so important. Sunglasses, so important to protect your eyes. Tightly woven material that could keep the heat out, keep you cool, but also protect you. And now there are so many companies that make sun protective clothing, and they actually make them really cute, especially for the kids. So get them in the habit of wearing sun protective clothing. The swim shirts are a really good way to protect a whole bunch of otherwise exposed areas. And that way the kids get into the habit of wearing these protective clothing when they're outside, so decreases the amount of the body surface area that is exposed to the sun, decreases the amount of sunscreen you have to use, and also builds good habits for their future. Make sure to check for sunglasses to be UV protective, because not all sunglasses are UV protective. So that's also something to check for. Make sure when you wear a hat or a sun protective scarf or a sun protective shirt that you're paying attention to all the exposed areas. A lot of times people do a good job with protecting the face, say with a hat, but then the chest is exposed, the ears are exposed, the lips, the nose. Like, just make sure that any exposed area you're thinking about and you're protecting. Now that we've covered seeking shade, avoiding direct sun, kind of adjusting our hours, wearing sun protective clothing, wearing a hat, wearing sunglasses. Now, what about sunscreen? When should we start? How should we use it? How do we choose one? So sunscreen has been proven to be safe for kids 6 months and older. And as a matter of fact, most pediatric dermatologists will tell you it's okay to use sunscreen on kids younger than 6 months if you cannot protect them from the sun with other means such as shade or clothing. But babies, when they're not walking and crawling, they're really under our control as parents. So we can easily move them to shade, have a stroller that has umbrella, put protective clothing on them. Like, there's so many ways to manage them to not get exposed to sun that we don't usually need to use sunscreen. But you can use sunscreen if you cannot avoid sun otherwise, and there is going to be a high level of exposure. But usually we like to start after 6 months of age, and you want to make sure you use a broad spectrum sunscreen. You want to make sure you're protecting everyone from UVA and UVB rays. UVB rays, as we said, are the ones that cause sunburn, but UVAs penetrate deeper and cause more deep damage and more wrinkles. So it's important to look for broad spectrum, or also sometimes the sunscreens spell it out, UVA and UVB protective. So that's also good. So SPF is sun protective factor. What it signifies is that how much more sun can you get with the sunscreen on your skin as opposed to not wearing any sunscreen and still not burn. So if you have an SPF 30, then you can get 30 times more sun and you still won't burn. Well, that's theoretical, and that's under lab conditions, and that's if you've applied enough. So there are variables in it, but that's a general idea, right? But what happens is that people think that if they wear SPF 100 versus SPF 30, then they're protected for the whole day. That's not the case. You sweat, you go into the water, the sunscreen kind of wears off. So you do need to reapply the sunscreen at least every 2 hours. So what we say is that SPF 30 and above is good. You have to remember to use enough. Basically, every exposed area needs to be covered with a thin layer, and then also you need to reapply. If the kids are at the pool, every time they get out of the pool, you need to reapply because the water washes it off. If you sweat, if you're running, if you're hiking, if you're outdoors a long time, more than 2 hours, you need to reapply it. Now, FDA has required to put this mark on the sunscreens as water resistant. Remember that there's no such thing as waterproof sunscreen. That doesn't exist, and now the labeling is changing. But there is water resistance, and then there's 40-minute water resistant or 80-minute water resistant. So when you're going to be using sunscreen for outdoor activities, it's best to use one of those water resistants, and then pay attention to how long they're water resistant, and then reapply it after. So just to summarize it, you want to use a sunscreen that is SPF 30 or more. You want to make sure it's broad spectrum, meaning that it covers UVA rays and UVB rays. So it has spelled out on the sunscreen itself UVA and UVB protection or broad spectrum sunscreen. And then you want to pay attention to water resistance, 40 minutes or 80 minutes. You want to make sure all the areas are covered, and you want to make sure you reapply. Now, I want everyone to know that sunscreen in the US is considered a drug. So when you flip over the container of a sunscreen, it says drug facts or ingredients. So you can easily tell what are the ingredients, what are the active ingredients in your sunscreen. Both chemical sunscreens and mineral sunscreens provide great protection. Mineral sunscreens are the sunscreens where they have active ingredient of zinc or titanium. They're traditionally the more white and pasty ones, so sometimes they don't go well with pigmented skin. So chemical sunscreens kind of smooth in better into the skin. But the industry is changing and new sunscreens are coming to market all the time. We have great mineral sunscreens that do have zinc and titanium, but also have a tint in them, have color in them. So there's a lot of variation in sunscreen that is available, so you can choose what works best for you. When parents ask me what sunscreen should I use on my child, the first thing I say is a sunscreen that your child will wear. It is really important to pick a sunscreen that you, for yourself or for your children, you guys like the texture, like the feel of it, doesn't feel too much of a textural change on your skin, so you will use it. Also keep in mind, some children have sensory issues. They cannot tolerate well the texture of the creams, so be gentle with them. Try to find one that bothers them less. It is very important. This is a habit that you want to instill in your children for lifetime. So be patient, be gentle, try different sunscreens until you find one that works for you and your family. Now, on the issue of texture and color of sunscreen, there are sunscreens that are mineral that do have zinc and titanium, but they're not that white and pasty. Why? Because they've broken down the molecules so small, they're now nano, like 10 to the 9th of a size, right? They're tiny, tiny little particles, and obviously they go on very smooth, they're really nice. So there's some controversy around them, like do nanoparticles get absorbed because they're so little? Do they get into our skin? So if the skin is intact, if there's no problem in the skin, there's no break in the skin, there's no opening in the skin, nanoparticles do not get absorbed and they stay on top of the skin. But on kids who have eczema and their skin is always open and everything can get in, then we do sometimes get concerned about absorption of sunscreen, and we recommend that you use a non-nano zinc sunscreen because zinc is anti-inflammatory, so it kind of helps the inflammation of the skin, but also it's not nanoparticles, so we decrease the risk of absorption. So this is something I hear a lot about parents that are concerned about the nanotechnology. But for myself, for anyone who doesn't have skin condition, the nanoparticles of zinc look beautiful. I use a tinted sunscreen as makeup all the time, and really has eliminated the need to use primers and foundations, things that I used to use a lot more when I was younger. So really the sunscreen industry has come a long way, and I promise you that if you look or you talk to your dermatologist, you can find a good sunscreen that works for you and your family, and it wouldn't be a burden to use it. So I hope this video was helpful. Please let me know all the other questions you have. I feel like we always talk about sunscreen and give points, but there's still people who have questions about sunscreen. So I hope this kind of helped answer a whole bunch of those questions, but I'll be happy to make more videos and get more in depth about any topic you want. So please follow me, subscribe to this channel, like it, comment, do all the things that people do on social media. That would encourage me to make more videos and hopefully help more people and more parents. Have a good day.